Mxiety. I am on tonight with Dr. I actually don't. It's Dr. Grizzly, right?
Yeah, you're correct. You
I was
got it.
like, oh
Nailed
my
it.
God, what if I was pronouncing it wrong this whole
No,
time?
you
And
crushed
then,
it.
okay, great news for me. Everybody, this is Dr. Grizzly. His specialty is talking about what he does on his platform himself is talk about LGBTQIA2 plus issues, and he's really good at it, and he does it while he plays DBD, and he also has just chatting streams where he does it. He's just a fantastic human. It was great getting to know him a little bit. All that being said, for those of you who don't know, what you're watching is Mxiety, and this is a talk show about everything and anything that revolves around mental health. The goal is to get mental health information out to everyone in an uplifting manner. We do that through professional interviews, conversations with other advocates, people with lived experience, and through wonderful, warm, open discussions with the community, which you are now a part of. So welcome, everybody. Super stoked to have you. Yeah. Hi. Hello. Okay. I did the spiel. Hi.
You crushed it. You nailed it.
So nice to have you. So excited to chat.
It's wonderful to be here, and thank you for such a warm introduction. I lurk in your streams all the time, and I enjoy them quite a bit, and really love the content and the community you fostered here. So I'm super excited to be a part of it and chat with everybody.
Thank you. Oh, thank you. That's so sweet. Hi, everybody. Hello, everybody who's here from Grizzly Stream. I appreciate all of you. Okay, hold on. There's a button that I press, and then all your links show up. That's the button. There you go. Okay,
Nailed
right.
it.
I want y'all to use those links. Go over to Dr. Grizzly's website. Go over to his Twitch. Hang out there. Get to know him. All the stuff. Yes, that beard is fire. I agree. You're talking about my beard, right? It's
absolutely right.
Glorious. Okay. Yeah. If you have a question to ask, actually, this episode is going to be super-duper interactive as opposed to just super-de interactive like usual. So please, what you're going to do to enter your question is !join, and then your question comes right after. And then that comes onto a list. Hold on. I probably have to open the queue in order for that to work. There it is. Okay, the queue has been opened. So we are going to talk about issues, but if your questions can be peppered in there, that would be pretty ideal. Thank you, everybody who's followed. Okay, so let's give us a background. What do you do? What's your thing? Let's
Absolutely.
Let's talk about it.
Square one. So just a little bit about me. Obviously, all of you know my name by now that I go by Dr. Grizzly here on Twitch. I kind of brand myself as the way I usually introduce myself to people is that I'm a queer variety streamer here on Twitch, although by variety, mostly games I play is Dead by Daylight. But I'm also a licensed psychologist, and I integrate a lot of mental health stuff into my content that I create. And so, like I said, I work as a licensed psychologist when I'm not streaming. I've worked in a variety of populations. Right now, I work with military veterans, actually, specifically. But a really cool piece of the content I create, just for those of you that are brand new to me. So on Sundays, kind of similar to what Mxiety is doing right now with opening up questions, I do something similar where I open up a Q&A for people to ask questions anonymously, where I put them on the stream and we talk about it, and they get support from other people. I share some thoughts. We share some resources. It's a really fun time.
Awesome. We're grateful to have you. So, and sorry if I spaced out at this exact moment when you said that. What is your specialty so a licensed psychologist could do all kinds of things.
Absolutely.
Yeah.
Absolutely. So, what I said was I work with military veterans right now. I don't know. I mean, it's a part of my work. I don't know if I would call it a specialty necessarily, but I think generally like LGBTQ mental health. Prior to this job, I was working at a university counseling center. Most colleges have counseling services available. And so that's the job I was doing. And I was working in a very rural area in Mississippi, which is not a super supportive place for LGBTQ people, as you can imagine.
Right.
And I was like one of I think 2 or 3 openly LGBTQ staff or faculty at the whole university. So understandably, every time a professor would run into a student who maybe was going through some identity stuff or needed someone to talk to, they sent them my way. So I got to work with a lot of LGBTQ college students, which was super valuable. And I think it kind of developed into a specialty from there. But I loved that work so much.
Okay. The questions we have coming into chat are hashtag priorities.
Love it.
Bliffle Splick asks, is the tree a year-round thing for joy reminders, or have you not gotten around to storing it yet?
That's not what it's for, but I might adopt what you said now that when I explain it the next time.
Right. So people get
On,
off your back.
right. Honestly, honestly, it's a little bit of laziness, but living down here in the South, like I said, I lived in Mississippi where I went to graduate school. I lived really close to New Orleans, and so I got to go to New Orleans a lot and kind of like immerse myself a little bit into like the culture there. And obviously, Mardi Gras is like a humongous part of New Orleans culture, and so for a lot of people in New Orleans, what they do after Christmas is they leave the tree up and they kind of redecorate it with like purple, green, yellow Mardi Gras mask. So it comes like a Mardi Gras tree. So that's kind of what it is now. It's kind of blurred, so you can't really tell. But yeah, so
Ah.
that's kind of what it is now.
Oh, I love that. See,
Yeah.
Bliff, shame on you. Judgy. I'm kidding. I know Bliff isn't judgy. That was a genuine question. Yeah.
hmm
But hi, Rib K. Hi, so nice to have you here. Dr. Goose asks, PhD or PsyD?
PhD. So my PhD is in counseling psychology. And I mean, I won't go super into like graduate school days, but like most of my research was on like personality factors, anger management, aggression, especially among what I looked at in my dissertation was like gay men aged like 18 to 30.
Hmm.
I looked at like interpersonal aggression there. So that's kind of my research areas too.
Okay. All right. Neat. Ooh, we like hearing about research areas. So
Cool.
you're good. You're good.
Love it.
So my next question is, I don't know if other people are wondering it, but I certainly am. So, LGBTQ issues are obviously they're different. The community itself requires a little bit of a different approach because there's still so much negativity, unfortunately, surrounding it, and so much just outside terrible crap.
Yeah.
I was reading the NAMI website and I didn't know this, but apparently in the US, approximately only 4% of the population of the US considers themselves LGBTQ. It's such a interesting thing to me because so many times people are like, oh, everybody's gay now, and I'm like, is it because I'm surrounded by a lot of people in the community, and so I'm like, is it? No, 4%, fam, 4%.
Yeah.
But yeah, so going from there, what are the kind of special considerations that need to be made for the LGBTQ population when it comes to mental health? I know that's very broad, so we'll narrow it down.
Yeah, we'll just dabble around in it. And like I think that 4% figure is actually really interesting you bring that up because there's been some like recent research about how that number probably is kind of an underestimate just because even in surveys where people know that their responses are anonymous, for some people it still feels a little too threatening to out themselves, quote unquote, like even in that format. But something I think that I've done some other mental health podcasts with people that were not like super familiar with LGBTQ issues, and so some of the things I like to talk about, I think a lot of mental health providers don't really realize that for a lot of LGBTQ or queer people, there's kind of like a healthy amount of, and I don't think suspicion is the right word, but just maybe a healthy amount, a little bit of mistrust when it comes to seeking out mental health providers because of that. All of those, for a lot of us having experiences of being, discriminated against and experiencing prejudice. And there's always this, for a lot of people I work with, there's always this kind of fear about like, is this provider going to like judge me? Are they going to, at session 5 be like, so do you want to change your identity? Are they going to pressure me in some way? And it's an unfortunate reality that some of those providers still exist. And even finding like openly queer mental health providers or ones that will openly identify themselves as safe spaces is still not very easy. And so yeah, I think for a lot of queer people, I think that obviously stands in the way when it comes to seeking out mental health treatment. I think another piece of it is much like any identity when it comes to sexual or affectional orientation, gender identity, we're all sort of at different like stages of like of those identities. And I think for a lot of people don't really realize that if I say that I'm a gay man and the person next to me says that they are a gay man, we may be in two very different places in terms of like where we are on our sort of journey of, for that identity, or may have different feelings about it or different concerns about it. Um, and I think, even when we say the word queer, that's obviously kind of an umbrella term, obviously. But even, within that, within the acronym of LGBTQIA2 plus, I mean, those experiences look so vastly different, from one person to another, let alone when we intersect things like race and class and other identities. So I think there's a ton of like really unique issues when it comes to queer people accessing mental health.
Absolutely, absolutely. And from my understanding, I mean, there's a lot of people who, like me, also are just I guess there's a lot of fear of like, is the community going to accept me if I come
Mhm.
out and I identify? So, because I feel like there's also there's some animosity within the community itself.
Mhm.
Like
Oh yeah.
it's not all accepting and kind. There's a lot of things to deal with. The stuff I've personally dealt with is bi erasure, which is
Mhm.
not something that I thought. Like, I was
Mhm.
just so excited to finally be like, yes, I'm gonna come out and be myself. And then
Right.
people are like, bisexual people are actually the devil. It's like,
Mhm.
that's
And, and
not.
to
Yeah. Sorry. Go
and to
ahead.
experience that from like the people that also identify as LGT, all those other letters, of course,
Right.
to experience that kind of erasure from within your own community, I think
Right.
is really shocking for a lot of people as it first happens. To see the marginalization amongst an already marginalized community. I mean, even if we could have a whole separate like discussion about like racism, for example, within the
Oh my gosh.
LGBTQIA2 community. I mean,
Yes.
it's incredibly prevalent.
Yeah. Or
And so yeah,
trans
you're exactly right.
issues and
Hmm.
the whole argument between cis and
Yeah.
cisgender and trans, it's awful
Hmm.
as well. Yeah.
Yeah.
Um, that's okay. These are all great. Okay, so there's some great questions are coming
Love
in.
it.
So why don't we focus on
Let's
those?
do
Okay,
it.
Dr. Goose asks recommendations for therapists wanting to be more competent in treating LGBTQ plus outside of those mainline CEs.
Ooh, that's a super good question. I have to think about that for a second.
I can connect
Um,
you two later, by the way. So,
yeah, that would be awesome. Yeah, please connect
so
us.
if you
Absolutely.
can't think of someone right
Yeah.
now, it's totally okay.
I guess I'm sort of thinking like anecdotally, I think people that I have worked with, colleagues, have found it really valuable when they've like come to me to say like, "Hey, I have this client who identifies as lesbian. I'm having some trouble like understanding this piece, or like, do you have any thought?" Like, I think sometimes even just that consultation,
Yeah.
well, with another queer provider can be a really great way to learn kind of in depth and in the moment, some different techniques, skills, and information that allies training, or like some
Right.
of those more common CEs maybe won't necessarily teach you. um and I think another piece of it is just getting experience working with queer people, like
Hmm.
actively seeking out those clients to work with, because I think as if there are any other clinicians in chat, like, as like that's the one of the best ways to learn, is to sort of throw yourself into it with appropriate supervision and things like that, of course,
Right.
but
Right.
to get that experience very directly.
Yeah. Well, that kind of brings me to the question I think I ask when it comes to any marginalized community. Do you find that it's easier and better? Like, if I am a cis straight um, uh, licensed psychologist, right, and
Hmm.
I am treating a patient that I find
Hmm.
out, comes out to me as lesbian, is it
Hmm.
better to refer to them to another therapist who is part of the community, or do you think that I can provide them with a pretty okay care?
Sure. Yeah, it's a really tricky, like, and this is a very good scenario because this happens all the time.
Right.
Because what we have to be careful about is, like, let's say a client, in therapy self-identifies as lesbian or becomes open about that. If their psychologist is suddenly like, "Oh, sorry, I need to send you to like Dr. Smith over here," that can really send a very like stigmatizing, like message to that
Right.
person of like, "Oh, I
Absolutely.
I identified myself, and now
That
I
made
have to
me
go
other.
somewhere." Right, yeah,
Yeah.
like, yeah, I've been othered, exactly.
Yeah.
And so I feel like, for a lot of providers, hopefully they know just through ethics and things that they need to seek out appropriate supervision or training, through CEs and other things. But certainly, I think part of being a clinician is understanding where that line is of, okay, I've reached a place where I'm not able to provide like quality care to this person. Let me make sure I find someone that can. And so I think sometimes it's kind of an internal piece, like barometer, that I think clinicians develop just through knowledge, and I think through a lot of experience too.
Got you. Okay. Great questions coming in. What is your preferred process for working with shame, internalized transphobia, and learning to love your identified self? Oh, what a beautiful question.
That is a beautiful question, and I think an incredibly complex one,
Right.
because those identities, even under the label of trans, can be so variable. Something that a really valuable piece of my work that I did back when I was working at university was I started a group for, it wasn't really just for trans people, it was pretty much for anyone that did not identify as cisgender. So it's pretty much everyone outside of that. And I think there was something really uniquely powerful about working in that group setting, to sit with other people who could say, like, yeah, I know exactly what that feels like, or I have felt that too, or, I can absolutely relate in that way. And we know empirically that, for many marginalized groups, one of the number one predictors of how well a marginalized person will cope is connection to to their community, essentially. And so I think, one place to start that I often start with is, okay, can we connect you to like a LGBT resource center, local to you, or if I was at a university, like, is there like an on-campus group that maybe we could connect you to? It's really expanding that person's support network, initially, as much as possible.
So, does that? Oh my God, I lost my question.
You're
Shit.
fine. It happens to
Uh,
me all the time.
oh my God, I was so on top of it too. I was like, this is gonna be the best
I'll
question.
be
And I
like
think I
in
was,
therapy
yeah.
and I'm like, "Ooh, I have such a good question for you," and I absolutely lost it.
And I totally, it's gone now. It's so gone now. Um, but no, what I was wondering about is what resources. So if somebody comes to me
Hmm.
and I have this happen quite a few times where actually
Hmm.
somebody's come to me and said, I think I'm trans. I'm kind of freaking out about it. I don't know how to tell my family about it. I don't know how
Hmm.
to like approach it even with like my closest friends.
Hmm.
I, of course, always try to send them to resources that are
Sure.
appropriate to them. So, like, my go to is, of course, the Trevor Project, but I should know more stuff than that.
Yeah.
So, what are kind of maybe some basic
Sure.
1, 2 steps that I can take that would make that person know that, like, they're safe and comfortable and I'm not just going, oh, go over there because I don't know what to do with you because I don't want them
Abs-
to feel that way either.
Absolutely. So I think something, and when I've supervised therapists, I always talk about this, but I think this is true for mental health professional or not. What I really like to espouse is when somebody comes out to you or is open about their identity, I really like for people to thank that person for
Okay.
being open, because it takes such courage, and it's a huge act of vulnerability on that person's part, and hopefully means that they in some ways trust you, in that moment. So I think I always like to have people like acknowledge that, like, thank you for sharing that with me.
Yeah. Yeah.
I know that must have been difficult, that type of thing. When it comes to trans issues specifically, I really am a huge fan of Trans Lifeline. I
Okay.
think they're a wonderful resource. They do, crisis counseling, but they also do just like general kind of like peer counseling. And what's great about Trans Lifeline is it's staffed completely by trans people. It was created by trans people for
That is
trans people.
awesome.
And it's a wonderful, wonderful community, and streamers on Twitch are doing charity fundraisers for them all the time. But they're a super great resource that I would definitely recommend.
Okay. All right. So, but how do you approach that from the perspective of specifically my saying, I want to help you, right? I
Hmm.
don't want to make them feel othered, but
Hmm.
I don't have experience with this thing. And so
Hmm.
my immediate reaction is kind of a little bit of panic from the sense of like, oh my
Hmm.
God, I'm not going to be able to help this person the way
Hmm.
they should be helped. So
Hmm.
kind of where should I pump the brakes and where should I like what should I be I guess focused on? Like what's a better
Hmm.
mentality to have about that?
Yeah, I think to validate like your reaction, I
Right.
think that's true for a lot of people, to feel some anxiety or nervousness about like, oh, I don't know how to like deal with this, or I don't know what I'm supposed to do here. Of course, it's coming from a good place of I want to do the best thing for this person. I want to support them in the best ways that I can. But like I said, I think acknowledging, when they're open with you about that, of course, asking about pronoun preferences,
Of course.
name preferences, of course. And I think those things feel very like minimal and kind of like, oh, of course you should do that. But like, I think it actually sends a very significant message. And I think can really convey that that's the safety of being with you in that moment. But what I often recommend to people is that one of the best ways I think to offer support to someone, and you may not know exactly how, is to simply ask them about like, how best can I, thank you for sharing. How best can I support you right now? And I think that at least opens up the door to a conversation about like, oh, well, I don't know if I can necessarily do that, but I know someone, that can, or I know an organization that can.
Gotcha.
But I think
Gotcha.
that's, to be honest, like I always, that's the approach I often take too. And I would definitely recommend it.
That's okay. That feels good because that's also that's my default approach when it comes to
Hmm.
mental health concerns, period, is you
Yeah.
validate and then you ask how you can help and then you
Hmm.
provide resources. So those
Hmm.
are the steps that I always take. So it's good
Hmm.
to know that they're applicable. So
Yeah,
that's
I think
awesome.
it's like first aid, right? It's like mental health first aid. I
It
think those
is.
are like the like really basic, just kind of like, how can I help in this moment? Let me be here to support you in whatever way I can.
Yeah. Yeah. That's very true. Mental health first aid. We
Hmm.
have algae,
Hmm.
which I should know off the top of my head, and I don't. Hold on. Now I actually know. I need to say it. I need to be able to say it. But um, uh, it is like acknowledge, give resources. Nope, I got nothing. I know the steps. Like I
I
know the steps that I would take.
It's been so long since I did mental health first aid myself. I can't remember the acronym either.
Oh my God. If
Ooh,
anybody
big raid.
remembers LG, I'd appreciate it. Hi, welcome, everybody. So nice to have you, Sarcastic Jay. Can we get a shout out for Sarcastic Jay, please? He's a wonderful creator. Absolutely positive, wonderful person. I got to play with him on Friday. We played some Monstera 2. It was really awesome. So thank you so much for coming in. It's exclamation join if you want to ask any amazing questions to our amazing guests. Thank you so much for all the follows, by the way, that are coming through as well. Appreciate them very much. Good evening. Thank you so much for coming by. For those of you guys who don't know, what did you just fall into? My name is Mxiety. I'm a mental health talk show host, and the goal is to make mental health information uplifting and accessible to everyone. We do that through professional interviews, conversations with advocates, open discussions on various topics with people with lived experience, and a beautiful community, which now you Raiders are a part of. So please welcome on in. Remove that little Raideroo from your URL. So it's just twitch.tv/Mxiety, and enjoy the heckin' show. Assess is the first one.
There it is.
Listen, give, encourage. Yeah,
Double the encouragement.
yeah, it's so much encouragement. It's encourage them to seek professional help, and encourage them as in let them know.
Mm-hmm.
Yeah. Anyway, we got this.
We nailed it.
We nailed. Yeah. Oh God. Take this as Evo, which extra virgin olive oil, which I remember that, but I don't. It's validate. I know what to do, fam. Just try. I know what to do. I just don't know the letters.
You didn't expect a quiz today.
No, I didn't expect a quiz today. I also you couldn't. My brain does not work in acronyms. You couldn't. None of this is helping. It's in there somewhere. But like, if you came to me and you had a mental health crisis, I would know the steps to take.
Right.
I wouldn't be like, get out of here. You're asking for attention. So we're good. I think we're good.
Right.
Empathy, validation, and offer options.
I like that.
Yeah. Take this. Nailed it.
Mm-hmm.
But welcome, everybody. Thank you so much for being here. So sit back, enjoy the show, and ask your questions, because today is super interactive.
Mm-hmm.
Okay. That went just totally through the mountains, around the hill. Okay, so Inerexible Death kind of asked a question that we've already answered.
Mm-hmm.
I was just curious which issues affect the LGBTQ plus community, specifically in relation to mental health. So I think to summarize it, it's acceptance, finding your community, finding resources that are appropriate to you. So finding resources that are appropriate to your needs that might be a little bit more specific, that somebody might not be able to help you with, or just anybody who isn't trained might not be able to help you with. So it's a tough spot. And I've had a similar conversation with you know, people different races being like, how do I find providers that will get me on that level? So it's yeah.
No, absolutely. And I think I would only add to that, because I was just thinking of, as we were recounting all of that, that, you know, I notice a lot of like mental health providers, even in like research and stuff, will kind of like talk about the queer community or the LGBT community as like we're like this monolith, like we're just like this one thing, where it's like
Right.
there's so much diversity underneath that umbrella of queerness. And so, like, to answer your question, it's like we could devote like hours to that, because each letter, so to speak, I mean, I think comes with, you know, there's some overlapping issues, but also some
Of
very
course.
individual issues that differ across multiple other intersectional identities. But I think that's also like the beautiful part of being queer, is that there's so much diversity.
That's a really interesting question to me, because the more letters we add on to, you know, to
Hmm.
the acronym, the more I'm like, does this deserve a bigger umbrella? Like, that's
Hmm.
a simpler term than we can all use, which I guess to me is queer, but I don't think that that's the case for everybody. And certain things deserve their separate acknowledgement, absolutely.
Hmm.
But so the more I think about that and the broader terms, the more I
Hmm.
also think about the fact that, like, okay, do we put everybody under an umbrella? Or do we kind of
Hmm.
separate and say, here are the important parts of each part of this umbrella?
Hmm.
What's your take on that?
That's a tough one. I think one that a lot of mental health providers would probably have some arguments about. Um, you know, to what this is reminding me of is, you know, like on those Q&A streams that I do on Sundays, I very regularly get questions about like, hey, you know, there's these letters in front of me, but I don't
Right.
really feel like I fit in this one. Like I'm sort of in this camp, but like kind of
Mm.
over here.
Mm-hmm.
And so it's like, I think sometimes like our labels for identities can be both really helpful and really negative for some people, and that having a label sometimes can allow us to quickly communicate to other people, like, this is who I am, this is the group that I am sort of a part of, and, you know, all the values and behaviors and things that go with that. It helps us find other people like us that have lived our experiences, that understand them.
Right.
And at the same time, I think it can feel very ostracizing and othering for people that are like, well, I know I'm not heterosexual, but,
Right. I
you
got
know, or I
that.
know I'm not
I got that.
cis, you know,
Right.
but
Right.
like I don't necessarily fall under any of these other you know, letters necessarily. So yeah, I
Mm.
really think it's, again, I think it's like it can be extremely beneficial in some cases, and I think, you know, kind of othering in other cases.
Yeah. Yeah. Dr. Goose makes a really good point. It's like when someone says neurodivergent, it gives me an idea of what's going on, but I can't assume that everyone in that label is the same. Right.
Yeah, absolutely.
Ask 7 people, get 10 answers comes to mind.
Right.
Exactly, exactly. It can be comforting to have a community to go to when normal society has pushed you away. But
Hmm.
I think it's even scarier when you're like, well, I'm supposed to belong to this community, but none of these letters make sense to
Hmm.
me. And that's what
Hmm.
exactly what you're saying.
Yeah.
Um,
I think Dinosaur makes a good point too about, you know, about like that word, like using queerness. And I think in a lot of ways it's been like a reclamation of something that was, you know, a slur at one point.
right.
But that doesn't mean that everyone necessarily chooses to self-identify using that word, or likes that word. And so I think it just goes back to the importance of, you know, asking these questions about, you know, like what a person identifies as, how they refer to themselves as, but also just
Right.
like listening to, like, you know, active listening about like, okay, how is this person referring to themselves, like what
Right.
words do they use, and let me make sure that I'm reflecting that, you know, appropriately.
Right. 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 So Bailey Cream asks, can you explain what the two means in LGBTQ QIA2 plus? I haven't heard that one before.
I can, to some degree. I will say I'm not necessarily an expert in this particular area, so I want to tread lightly. But 2S generally stands for Two Spirit, which is more strongly associated with the Native American community. And so I really wish that I could like bring on someone that's two-spirited or has worked with two-spirited
I would
people
love that
more,
too.
that is
Yes.
more of an expert in that area. I've personally not worked with like a two-spirited person or had like a close relationship with someone's two-spirited. So I don't want to sort of just like make a guess at things or anything like that. But
Thank you
that's at
so
least
much.
you know, I want to know my limitations.
No, thank you
Um,
so much. God, do you hear that? If you don't know, you don't have to pretend you know, fam.
right, exactly.
You don't, now, nobody thinks you're smarter if you lie. Okay, I'm sorry. I
And if
got
someone in
really heated.
chat, you know, wants to explain their understanding of it, you know, if you were listening to this and you are two spirited or you know have a lot of information, like please feel free to talk about it too.
Yeah. Yeah. Gold stars for Dr. G. I agree all the time. Okay. That was part of the reason I didn't come out, because I was AFAB and I was still female and I was just also a man and didn't know that gender fluid was an option. Right, right, right.
hmm
Scope of practice. No, it's true. And
That's right.
I just so strongly, I love hearing I don't know. Because
hmm
that to me is the most honest thing that somebody could say. It shows a lot of vulnerability. It shows responsibility. It shows
hmm
that you're likely not going to lie to me, because if you did, you could have just done it. Uh,
right.
but it's like I respect I don't know so much. So
Yeah,
thank
no,
you for that.
absolutely. Yeah, absolutely. And I also I think this is like an important point as I'm, you know, sitting here talking about LGBTQ, you know, 2IA issues. By no means do I speak like on behalf of the queer community. Like we're
Yes.
talking about the diversity
Yes.
amongst, you know, under
Yes.
that umbrella. So as a cis white gay man, I have a very, you know, I understand things through my lens, you know, both personally and professionally. And again, I think that's just like important things to be really clear about too.
Thank you. Thank you so much for
Yeah.
thank you. No, these God, I really love you so much. I loved you the first time we talked, but like I
We
fall in
had
love
such a
with you.
great, yeah,
We
we clicked.
did. We just clicked. And then every time we talk, I'm like, oh yeah, I remember why I like this
Yeah.
guy. Uh, okay. Let me see. Where are we? Why is being bisexual still controversial even in the community? Asked Nighttime
Oh,
Blues. Let's
so
can of worms. We're opening
yeah,
it. Let's
right.
go.
Yeah. Yeah. You know, I think, and this is, I guess, more from a personal place, that I think where bisexual erasure, where I see it a lot, is especially for bisexual people that are in like heterosexual presenting relationships. And so they then are not like queer enough, quote unquote, or gay enough, or whatever like weird terminology people
You're not
use.
experiencing enough
Um,
discrimination. You see,
right.
like, it's
Right. And so
awful.
it's like it's like why can't you just sort of make a choice, or you know it's really bizarre, to be honest. But I think I see it the most there, especially for people that self-identify as bisexual that are in heterosexual presenting relationships. I see a lot of erasure, you know, in that particular place.
Yeah. Yeah. I mean, I've definitely also seen it when people identify not hetero, like in a non-heterosexual way, and then they're still
hmm
put in a, in a box. Like I have one of my really good friends is a lesbian who is
hmm
bisexual, who is in a lesbian facing, is that a term? Is that the right? Lesbian facing relationship, but is
hmm
bisexual. And it's constantly like, oh, but you're not really bisexual. It's like, no,
hmm
you don't, it's it's not like pie. I don't just pick one and then can never
right.
eat another pie again. That's not
hmm
let people be people. Yeah.
Exactly. Dr. Goose couldn't have said it better myself.
Yeah, I love that. Okay. Archon Orion asks, as someone who has recently realized that I have never known what my gender/sexual identity is, do you have any suggestions or resources in terms of helping me figure that out?
Ooh, super good question. And so I'm not to like self-advertise too much or anything, but like I said, Sundays I do those mental health Q&A streams. They're pretty much, my community is almost like 99.9% LGBTQ people. And so I think that might be a cool place to start to have some conversations with other queer people talking about predominantly queer issues. Again, like going back to what you and I talked about at the beginning, I think connecting to community can be really important for multiple reasons. And this can be one of those pieces about um, interacting with people that are maybe in a different place in their journey with their identity, and being able to interact with them about like, well, what was this like for you, or this is what I'm feeling, and to receive, you know, that validation, I think can be incredibly helpful. As far as like specific books and things like that, I don't really have anything off the top of my head, but I could probably get you a list if you just like shoot me a DM or something like that.
It sounds like it's time for you to add that to your website, like so
I
you can like
know.
link people out to this
I
stuff.
know.
Yeah, yeah. Is tough though. All of
That's
that.
a
So
good idea.
I know, but like every day I learn of some, and like the community knows this, where I learn of something that I'm like, I should make that, and then I'm like, I
Mhm.
look at this list of things I should make, and I'm like,
Right.
I'm tired.
So
Yeah,
long.
yeah. It's okay. It's okay. Also, don't you ever feel bad about promoting your I invited you to interview you. You're like, I don't want to promote myself, but here I
You're
am on
right.
a
You're
show
right.
about
I
me.
know.
Yeah, you're good. You're good. I'm also spamming the heck out of your link, so
I
like you're
appreciate
fine. You're fine. I hate you and dinosaur asks, I'm gender fluid and I'm also dating this guy. We call him, he is termed in the community bisexual boy.
Mhm.
And he's really sweet about everything, but I wish I knew how to talk about trans issues with him. Any tips on how to approach this?
Hmm. Well, Dinosaur, thank you for sharing about your identity with me. Um, you know, I have to want, I think this is like, there's obviously probably a lot of context and details and things that I'm not
Sure.
necessarily aware
Sure.
of. Like, my hope is that your partner is like open to these discussions and is like attempting, to try to
Right.
understand. Um, Certainly, I think hopefully for this person, like it's very clear to them about the differences, between like sexual identity and gender identity, and if not, maybe that's a super good place to start. But I also want to mention, and I say this a lot, that for marginalized people, it's not our responsibility to educate others. Like, it's not our responsibility to educate other people about our identities. Like, those people should gain that education on their own. And so I'm kind of tempted to put a little bit of the onus on bisexual boy, as we're as we're
Yeah.
calling them, to
Yeah.
to kind of put the effort in to better understand you and your identity. And I think it's very fair to be very open and direct about that. So
All too often it's placed on that burden is placed on
yeah.
the person, but like you're the one who doesn't know, so like you go find out,
Hmm.
right? Google's there without being a butt about it. Like there's no way to say that without sounding like like
Hmm.
a mean, but like it's the same with a lot of things. Like if you don't understand something, it's great to come to the person who
Hmm.
has experience in that area and ask
Hmm.
them. But
Hmm.
before you place that burden on them, consider doing your own research and
Yeah.
then coming at it when you come at it with a hey, I've learned this, but I'd rather hear it from somebody who's experienced it. That's a very
Yeah.
different conversation than like, so how's it being trans?
Yeah,
How's
like
that
what is
going for you?
yeah, I mean, it's just borderline, if not completely offensive, when people do that. And
Yeah.
like, what I call that is being carefrontational, which my community hates when I use that word, because I guess I made it up. But I think that's that kind of like
Wait,
that
repeat
direct
it. Sorry.
being carefrontational. So instead of like
Carefrontational.
confrontational, where it's like there's tension, it's like being carefrontational, where it's like, hey, love you so much, but I'm gonna really need you to like put a little effort in to understand me a little bit better, that kind of thing, where
Yeah.
it's like not necessarily yelling at you, but like
Yeah.
from a
Yeah.
place of empathy, but
Yeah.
like get it together,
Yeah.
like,
No, no, but I love I mean, how many times have people been like, "Oh, well you're even like just mental health issues not, taking aside, which adds
right.
another layer of, right? But
Hmm.
taking aside LGBTQ issues and just asking somebody about their mental health and being like,
Hmm.
"Oh, so you don't just want attention because you're depressed?" And then
Yeah.
but if I'm really depressed, like now's not the time for me to have to explain that to you. So that'd be really cool if you took a second and like thought about what you're saying before you're saying
Absolutely.
it. Yeah.
1000%.
Yeah. Yeah. Empathy trolling, carefrontational. I like that. Empathetically troll, just like, I love you, you're great, but
But get it together.
get it together. Um, so Maria Games asked, out of the queue, but I still want to address it. Is there
Sure.
like a particular school of psychology that you prefer to focus on in your sessions? I think that's the question they're asking.
Sure. Yeah, absolutely. So to answer this, like, I guess in a very detailed way. So in graduate school, I came from a very cognitive behavioral
Hmm.
program, which I'm sure on your stream you probably have talked
I'm so
about types
sorry.
of therapies and things.
You
And so
didn't
I
see
come.
that. Sorry,
What
a thing
happened?
just came up. So I have a screen capture, and Dropbox just came up with a giant thing just over my monitor. I'm so sorry. I had to address it. It was huge over
You're
your
totally
face.
fine.
Anyway,
But yeah,
professional streamer.
yeah, so yeah, CBT is kind of where my background is, but as in my own practice, I'm much more of it like an act-based kind of like third wave, mindfulness,
Oh,
acceptance,
okay.
commitment therapy. I really love interpersonal therapy, which is why you'll probably hear, like, if you come on Sunday, I'm often talking about like communication and being direct, and having very interpersonal connections in the moment and addressing things in the moment. Because that's very much my like therapy style is like, hey, I just saw this. Let's talk about it like right now. So that's kind of the, I guess, like fields, that I'm in.
Awesome, awesome, awesome. All right. Oh, that perfect transition, totally planned. Swole Patrol asks, "What's your thought on acceptance and commitment therapy to address anxiety and depression? Kind of like the idea of accepting problems as part of life rather
Mhm.
than treating issues as if they are a problem."
I like ACT a whole lot, as I probably just kind of revealed to everyone. Um, and like I'm not knocking CBT at all. It's obviously an incredibly evidence-based practice, and I think does a lot of good for a lot of people. I just think for me, stylistically, and I have found it really helpful for people when it comes to, instead of CBT, where we are like looking at thoughts, we're like grappling with them, we're sort of like trying to alter them or inspect them very closely. I really liked the cognitive diffusion piece of ACT, which is a really fancy term for just saying taking a step back and observing the thoughts we're having rather than becoming entangled in them.
Mm.
So I'm a huge fan of ACT in that way, because I think it's all about thinking and really navigating your relationship with the way that you think about yourself and the world around you. And I just love that stuff, and I think it's incredibly helpful. So I'm a huge fan.
Yeah, I've moved from, so I used to have a cognitive behavioral focused therapist, and I've moved into into ACT therapy,
Hmm.
and I feel like CBT is something I needed at the
Hmm.
time when I was dealing
Hmm.
with trauma, but now that I'm in a place of kind of just trying to focus on personal growth, ACT is doing a
Hmm.
lot more of that for me. So it just
Hmm.
depends. Yeah.
Yeah, and I think it's like any seasoned therapist. I mean, I think hopefully, like we're all trained to know that like there's not one approach that fits literally everyone with
Right.
literally every single problem. That's the point of us, learning more, doing CEs. Like I've seen people mention like DBT in chat. Like DBT is something that I don't necessarily use every session, but with certain like personality disorders or other presenting issues, like yeah, I'll jump right into DBT and those skill sets. And
Yeah.
so
Yeah.
I definitely think it's helpful to be multifaceted in that way.
Yeah, yeah. We do love some good DBT. We had a
Love it.
Dr. Alima too came on and was like DBT. And we're all like, all
DBT
right,
is awesome.
that's where we're
DBT is
going now.
great. Yeah,
I
DBT
mean,
is really cool.
listen, I love me some Marsha Linehan, but it's
Oh yeah,
it's also not for everyone because
yeah,
it requires a lot of well, I guess
yeah,
all therapy. I was gonna say it requires that you to do a lot of work, and I'm like, therapy requires you to do a lot of work. It's not
yeah.
sitting around and eating bonbons exactly.
Hmm.
Yeah.
Razor, DBT stands for dialectical behavior therapy.
Sorry.
That's
Sorry.
what that's what if that's the acronym you're asking about.
Yeah. Okay. Martizzle asks, therapy is so much work. It is. It is. Martizzle
Hmm.
asks, how does one know if they're bi or pan or just open?
Ooh, that's a really good question, and I'm sort of sitting here like, as a gay man, like, can I really like like
I can
answer this
try to address
necessarily?
it.
Yeah, I mean, yeah, I go for it.
From a bisexual stand, I know I'm interviewing you, but from a
Go for it.
bisexual standpoint, I thought about, because this goes into, there is an argument made that like bisexuals are discriminatory because they are not so pansexual says you're attracted to anybody
Hmm.
despite or whatever their
Oh, I
gender
see.
identity might be, right?
The
And
argument is that bi people are only want people on like one end of the spectrum or the other.
right, right. And I could see that argument.
Hmm.
I don't agree with it. I
Right.
think it has a lot to do with like who and what you're attracted to,
Hmm.
right? And for people that's different. So
Hmm.
it's not that I don't like, I love people in terms of
Hmm.
like any person comes to me no matter what they're whatever they identify with, I'm going to love
Hmm.
them and tell them that they matter and they're important to me. But like when it comes to how I like sexually identify, it's a little more binary. And I don't know if that'll eventually become like more fluid and pansexual, but at the moment it's fairly binary. But that being said, I do feel like it's a very thin line. Like, have I ever looked at somebody who is, you know, more masculine but appears feminine and been like, oh, wow. Like, I've still had some attraction to those people, but I think it's pretty, it's a little more binary for me. And in that, people have made an argument that like, oh, well, you're a terrible person. So there's that
I
too.
appreciate you sharing so much about your experiences. That was super, super helpful for even me to hear. So I really appreciate you sharing like that.
You're so, I love you.
And I think someone brought up like I think love and attraction, and like I think that's also a good point, that, and I think one that we don't talk about enough, that we often of course talk about like sexual orientation, but there is a whole field of affectional orientation about
Oh.
not just the people that we want to engage with sexually, but also like people, you know, the spectrum of people that we want to engage with romantically, if at all.
Right.
So I just think that was a good point someone made I want to touch on.
Thank you. Yeah, that's really good. Attraction and love is an option, but not guaranteed. Yeah, it is beyond attraction. It is. It's really interesting to me. I need to talk to my sister because she just came out. I don't think she's watching or anybody, so I think I can say she just came out as pansexual, and I came out to her
Very
as
cool.
bisexual like the same month.
That's
And we
awesome.
were both like really, really freaked out.
Like, hey, like,
Yeah, but it was really cute because I was like, I have to tell you something. I know you're gonna accept me, it's weird to say it because I don't know that I have to say it, but I want to say it. And she was all like, oh my God, I have something like that too. And so we were sitting there in the car and like going back and forth to each other. And I was like, okay, I'm gonna tell you my thing. And she's like, okay, you go first. And then she's like, oh, I was gonna tell you that I'm pan. And I was like, oh,
that's awesome.
I was like, well, that worked out because nobody's judging anybody for sure.
Right.
So I would love to, I think it would be really good to ask her and be like, what's the difference? Like, how do we feel? And again, it's specific to us, right?
Yeah.
But I would love to know, like,
that would be a really cool conversation.
Right? We haven't, because she's been on the show, but we haven't talked about.
Yeah, that would be really cool, I think.
Yeah. Jinx says, for me, I'm bisexual because it's the label I grew up with, but I'm open to any and all people who are kind people. For me, it's the same as pansexual. I just prefer the label bisexual. And that's great. And I think that goes back to all the way to the beginning of our conversation where like different people are going to, there's not two bisexuals that are the same kind of person. And that's the bottom line. I have relational gender fluidity. Oh, I didn't know about that. You and your sister are so hecky cute. Does Dr. Grizzly have any advice from someone who suspects they have complex PTSD due to growing up with a family environment that was very abusive in an emotional, psychological level? I'm in that position, but I know it's not recognized diagnosis in the DSM, and I'm wondering if my problems might not be taken seriously due to that, even though they're really massive to me. So Maria Games, next time add yourself to the queue. I'm really nervous that I'm gonna miss your question next time because chat moves. Thank you so much for the sub, by the way. Okay, go ahead, answer the question.
Well, Maria, thank you for asking that question, sharing a little bit about like your own experiences. And you know, my hope would be that no matter what mental health provider you went to, regardless of like what your experiences or what you're attending therapy for, would take you seriously. I think like in any way, if you were sensing that from a mental health provider, that's a really good time to take leave and switch to somebody else. And even if it's not necessarily like something that meets the criteria, quote unquote, for like PTSD, I think that doesn't diminish the pain that you've experienced, or or your experiences at all. And so I still think it'd be worthwhile experience to try therapy out if you haven't before, even if it's not quote unquote technically meets ABC criteria in the DSM.
Got you. Yeah, that's what I would encourage too. Like if anybody's like, I'm not gonna treat you because this isn't in a book.
Yeah.
Yikes.
Yeah, that would be major yikes. Yeah.
But yeah, inexorable death. I just ask, let's not educate other people about their sexual preference. You can't tell somebody that they're one way or another. If somebody says I'm bisexual, that's how they identify, and it's up to them to identify differently at some point. So I just want to make sure that we're straddling that line and being respectful. And just wanted to point that out. Yeah. Okay. So, hello all people. Please submit your question into the queue because I'm gonna start losing these questions.
Right.
I'm not sure if I'm bi or not. I know I'm bi curious. I would not be opposed to sleeping, but I don't know if I'm fully bi or not. I feel like it might be that I'm just lonely or just want a relationship, but I don't know. Also, I've always
Mm-hmm.
seen myself marrying the opposite gender, but I don't know if that's just because I came from a very standard hetero family and barely even knew LGBTQ plus when I was in eighth,
Mm-hmm.
until eighth grade. Any advice if you have any?
Hmm.
Hello,
That's
good
again,
question.
yeah, super good question. And these kind of conversations are one that I have on my stream on Sundays all the time, where we talk a lot about identity and identity development. And I think something important to remember is that the good thing is, like, you don't have to have the answer for all of these questions like right now. As much as we would want that, right? It'd be great if we could just say, like, yeah, I'm bi, or yeah, this is the person, or gender identity that
Right.
I think I'm most attracted to. But the beauty of these identities is that they are so fluid, and that they can change over time, and that we sort of develop a better understanding of them as we get older and have more experiences. And so, I would certainly encourage you to, if you have people in your life that you feel like would be open to these conversations, or they themselves have identities that feel relatable, or trying out going on a date with someone and seeing what it's like for you. I really think it really boils down to like very personal experience, and how those experiences kind of land for you. And again, super super appropriate topic for therapy. That's like an amazing topic for therapy, great things to talk about when it comes to identity. So I do think like a therapist could also be super helpful when it comes to that journey that you're on.
Oh, I love that answer. I love
Yeah.
everything about that answer. Oh God, you're so wonderful. Okay, Inexorable Death asks, given the high levels of suicide in the trans community, why do you feel
Mhm.
this issue isn't taken more seriously in the LGBTQ community? If this rate of suicide was the norm, it would be a national crisis.
you I agree with everything that you just said. I think it boils down to transphobia, honestly, within the LGBTQ community. Like, Mxiety, you were talking about earlier, like marginalization within our already marginalized community.
Right.
um and the way in which trans people, especially trans people of color, are marginalized and othered from people they probably feel like should be accepting, or should
Right.
offer them support. I mean, I, I can't even fathom like what that must be like for them. Um, and so I think, unfortunately, I think transphobia is really at the heart of it, as to why um, trans people's concerns, their problems, their experiences are not taken seriously. And like what you said, like, if that suicide rate were seen somewhere else, like you said, it would be like a national emergency or crisis that we would look at more closely. So that's, at least for me, like what jumps out to me is likely the culprit there.
It's really, really disappointing when I think it was a huge for me as a cis, you know, just as a cis person, it was a huge eye opener to see Trump. I'm saying it, but to see Trump roll back so many protections that were
Yep.
enabled in the trans community, where I was like, we're on this straight trajectory of acceptance and love for everybody. We're good. We're
Hmm.
going. We have full steam. And then
Hmm.
to see him revoke it, I was like, oh, this is not everybody's sentiment. Everybody's not. It was a
Hmm.
huge eye opener for me, which is shame on
Oh
me, but
yeah.
still, it was a huge eye opener for me to be like, oh yeah, not everybody's on the same train I'm on. There's a
Hmm.
lot of work to be done,
it,
and that
it's really
sucks.
it's super disappointing. And even I just feel like over the last, I mean, 2020 felt like it was a decade long, right? But it feels like so many people that are famous, authors, whatever, that like people that I think, at least for me, like I really liked or really look up to, and then they come out as like turfs and incredibly transphobic. And
Some
it's just,
authors, did
it's
those
like,
authors
yeah,
write
I was
Harry
just
Potter by any chance? God
J.K.
damn
Rowling is an
it.
excellent,
Oh my God, she ruined everything. I hate her
excellent
so
example
much.
of that.
It
And
makes me hate
so,
her like on like four different levels
yeah,
because
it's
yeah.
incredibly, it's a lot of feelings around that. But it's just mind blowing how and I think someone in chat kind of mentioned this, that it feels like transphobia seems to be like almost on the rise, and I agree, it does
Yeah.
seem to be like incredibly present. But my hope is that that's out of virtue of that we are pointing it out, we are calling out transphobia where it exists, where I
Yeah.
think in the past, like, people either would not do so or just were not educated enough to do so. So my hope is that the reason that you and I feel like we're seeing it more is that maybe we're hopefully seeing just like increased conversations and accountability around it.
Yeah. Dak made a really, it's sad to see how they appear to be against discrimination while discriminating openly.
Yep.
Yeah, when accepting
Agreed.
people are in charge, acceptance and tolerance is fostered. The opposite is more than true. It's true. All you need. So it goes both ways. For kindness to prevail, you need kind people in higher positions saying kind things in a way that makes people go, oh, this must be the norm, right? We listen to those important, influential voices. So if a huge influential voice comes out and spews out toxic garbage, all of a sudden you're like, oh my God, is anti-trans feelings on the rise? Well, they are, because she's given them a voice. And that's what's really, really shameful.
Yeah, infuriating about it.
Yeah. Whitey, get out of here with those questions. Warrior Master, thank you so much for gifting a sub to the community. I appreciate it. Thank you kindly. Okay, I missed a bunch of sentiment here about the author. We're good. Okay, this is just because it's interesting. Relational gender fluidity is basically my gender identity. It can change based on who I am hanging out with or who I am seeing. So I'm both a gay man and a lesbian woman. It's complicated. No question, just needed to be center of attention.
I love that. I love that you shared that. And what it makes me think of, I talked about that group that I had earlier, and I had a particular group member who identified as gender fluid, and they actually had a necklace with different pronouns on it, and they would sort of like flip it for like, okay, like today, when I'm here right now, these are the pronouns I prefer. I just kind of loved that it was just like, boom, here you go. Like,
this is me.
Don't ask me questions about it. It's right here. Like, you can't get it wrong. Like, I just loved it. So thank you for sharing that.
Oh my gosh. I love that so much. Just my opinion, but I believe peace will only reign when bigots of all kinds are seen as criminals and punished accordingly. I mean, the only way you beat intolerance, that sounds terrible, beat intolerance. The only way you are able to prevail over intolerance is to make sure that people know that it won't be tolerated, right? That like you can't quietly be like, oh, I'm against that. People have to speak up and say things so that other people know, you know, where not only where you stand, but what you stand for.
Absolutely.
Yeah. Okay. Thank you so much. Razor Pyro asks, can you confirm my description of CPTSD? So it's complex post-traumatic stress disorder. Is there something else that I'm missing there?
Oh, let me see here. I'm just reading your comment real quick.
Okay.
As little t trauma, so it comes from events that on their own aren't particularly traumatic and don't cause PTSD with a single exposure, but repetitive. To be honest with you, complex PTSD is not something that I really was ever taught like in graduate school, and so like, to be honest with you, my knowledge about that as a label or a term is not very in depth, and so unfortunately I don't know if I could really answer that for you, but my hope is that by your therapist calling, I've heard little t trauma where it's like, well, it wasn't necessarily life-threatening or no one died, but my hope is that doesn't, I've always just felt like that comes off a little bit dismissive to say like little t trauma. I don't know.
It's kind of like saying I have a little OCD.
Yeah,
I don't have OCD.
It feels a little weird. It feels a little icky, but
yeah,
I'm sure there are people that are much more educated about complex PTSD or that terminology that could better answer that.
Yeah, not a singular. That's how I was taught it. When is that it's repeated events instead of just like a singular. Like PTSD can be from like a singular, like a vet who returns from war likely has like PTSD. Complex PTSD might be somebody who grew up in an abusive family, right? That they couldn't get out of for 18 years. Like that.
Makes sense.
Kind of an easier way to look at it. That's what I know, but I'm also not a professional. So Ella, probably being diagnosed, probably knows a little bit more even. Yeah. Warrior Master, thank you so much for gifting another sub. I appreciate you. Rhino Jerky, thank you so much for the follow. CPTSD is spicy childhood. I don't know why I read that out loud. There's so many comments that I had to miss, but I read that one out loud. Oh gosh. Okay. All right. Nighttime Blues asks, I don't know how to ask this delicately, so apologies for maybe being blunt, but how do you view the argument of polyamory being a sexual preference versus a lifestyle choice?
Woo. That is absolutely a hot button topic.
Loaded.
And I guess I've never really taken a side as to whether or not that's like a sexual identity or a quote unquote. I kind of hate the phrase lifestyle choice because I feel like
It's
on a
never a
personal
lifestyle
level,
choice.
right? I've always had people refer to my gayness as like a lifestyle choice, which
Right.
feels like a little, I don't know, it feels a little homophobic. I don't like it. To be honest, like I think polyamory and polyamorous relationships are completely valid and
Mm,
are, I think for people that enjoy them, that's again, it's like what we've been talking about, like let people live how they want to live. Um, and so to me, I guess I'm in the camp of like, is it really important whether or not it's like a sexual identity or a lifestyle choice? As long as people are happy, everyone's a consenting adult, boundaries are respected, communication is
right.
open, I'm here for it.
Yeah. I don't know what it is, but lifestyle choice ain't it, Chief.
Yeah, it's just ugh.
Everything is a lifestyle choice.
Yeah.
No. No, I just yeah, I wish there was a better way to this, but it's not that. But it's an interesting question. Okay, hold on. Let me see where we are. Okay, Ella the Almighty. A CPTSD we confirmed. Hello, all people asked. I had a friend who was trans, male to female. I loved
Mhm.
her as a friend, but she was always so distant. It was hard to watch her dead name herself in class, so the whole class didn't know she was trans. Her parents were not accepting and wouldn't let her transition. This
Mhm.
doesn't seem like a question, so maybe I'm gonna make it a question because I'm wondering,
Mhm.
how would you what do you do when you see somebody when you maybe you have a trans friend or even
Mhm.
maybe if you have like a bisexual like anybody you have a friend
Mhm.
who is on the in the LGBT family
Mhm.
but is hurting you watch them actively hurting themselves and saying no
Mhm.
I'm not gay or no
Mhm.
I'm not trans here
Right.
what do you do
Yeah.
because you want to just be like I love you.
Right. It's a very tricky situation, I think. It's something that I really preach a lot is about, definitely respecting people's boundaries around this because like for your friend, for example, or like a hypothetical person, like in class, I think is an excellent example. For a lot of people, those are like safety behaviors. And so from
Hmm.
outside looking in, it's like, oh my gosh, this person is dead naming themselves. But for that person, that might be just a learned safety behavior where they know if I were to use a different name, I will out myself to these people around me, or
Hmm.
maybe at home, I imagine they're probably getting dead named constantly. And so again, I think it's kind of what you and I were talking about earlier about approaching a person, a friend and saying like, hey, are there other ways that I can support you, with your identity or with other things? Like, is there anything that I can do for you, or can I even just be a ear that you can rely on to vent, like to do any of those things? Because again, I think for a lot of queer people, especially queer people in very discriminatory situations with their family and otherwise, there's such a lack of support, a lack of social support. The familial support is obviously lacking because they're at home. But
Right.
if we can be a source of support for that person and actively listen to them and hear
Yes.
them and refer to them the way they want to be referred to and recognize and really see them, I mean, there's so much power in that. And so that
Yeah.
would at least be my recommendation. Yeah.
Follow their lead. I
Hmm.
wanted to. A raid just came in. Thank you, GoPum SS GoPum for the raid. I appreciate you and your community. Welcome, welcome. I'm interviewing Dr. Grizzly tonight, and he's answering all kinds of questions relating to
Hmm.
LGBTQIA2 plus and mental health. So
Hmm.
join on in. I hope you all enjoy
Hmm.
it. So hello, people. Kind of secondary asks. The question was
Hmm.
almost what was said. How should I address them if they dead name themselves in class? Should I use their dead name also, or should I call them by their preferred name? So we kind of answer that. But if you have
Hmm.
anything else to add,
I mean, I like what people in chat are saying about, especially the piece about trans people are experts on their own experiences, and following someone's lead is absolutely important. And so I think it's okay to ask, if you, I guess it depends on the friendship there, right? Like if you know this person is trans, they've come out to you. I think it's okay to say like, hey, what name would you prefer? Like that I refer to you as, because again, that person may prefer to be dead named in public situations just to protect themselves and their own identity. And so again, I think it's absolutely important to ask those questions openly, and follow that person's lead in their experiences.
yeah, yeah. Lost forever. I'm tired of the LGBTQ community hating on asexual people. Eh, can we address that? I don't know how to address that, but can we?
I mean,
know.
I think I think you're exactly right in that there's absolutely asexual erasure.
Right.
That people don't, that there's plenty of gatekeeping that happens among LGBTQ people about, well, oh, well, this person that's ace, doesn't belong like in our community, or is too different from us. And so I think again, it's going back to that conversation we were having about marginalization amongst a marginalized community. I absolutely think that ace people, and aro people too, aromantic people too, absolutely experience that erasure.
This is amazing. I think we're at the end of our queue. I can't believe it. I can't believe it. And that's wonderful because I mean, eventually you gotta go. You're home. I don't know what I'm saying. Everybody go home. I know
Right.
you're not home right now. Go home. But thank you for your support. Of course, of course. Oh, actually, I love that. So Ashley Lynn just redeemed emotional cookie, and an emotional cookie is something you give yourself. It is a reward you give yourself for treating yourself kindly. But it is an emotional cookie. So
I
instead of
like
a
that.
real one, like giving yourself a piece of chocolate, you give yourself an emotional cookie. So, what is something that you did for yourself that was really good today that you'd like to give yourself an emotional cookie for?
Oh, that's a good question. Let me think about that.
I'll give you some time.
Well, I think one for me is, so I experience, so if you chat maybe can relate, but so I see patients obviously every day, and I have to write a bunch of reports, and I will often like really guilt trip myself if I've not
Oh,
like worked like the entire time. And today I felt like I was a lot better about accepting that. I was like, you know what, this is as much as I can give this today. This is as much as I can pour myself into this. And so I think for me it was just like self-accepting that was like, this is my limit and that's okay. And I'm going to take, some time for myself to do something a little more enjoyable because I've earned that.
heck yeah. Oh my gosh,
Yeah.
I
I love
love
emotional
that.
cookie though. I love that. That's awesome. I love it
Yeah,
though.
yeah, that we have an emote and everything.
That's
And
great.
it's fun to explain it to people because there's a little bit of Pavlov in
Yeah,
there.
it
It's
was
fun. It's
cool.
fun times. Yeah. No yoga poses during the interview. Thank you, Whitey. I appreciate it. Unless it's too late, people keep asking me to pick a pronoun, and it makes me sad and feel bad that I don't like they. Any tips on how to stand my ground as far as pronouns? What pronouns do I use? Both she, he, rolling pronouns could be good for people with sexual identity
Hmm.
too. Mm.
Absolutely agree. And I just don't know if you responded to this, but I talked earlier about that necklace that
Yeah,
person,
yeah,
that
yeah.
group I remember wore, that, but there's like bracelets and there's other things. But again, like it's not, I'm not saying it's your responsibility to literally wear your pronouns. Like
Right.
by no means am I saying that. I think in some ways it just can make it a little bit easier. So if you don't feel like people are asking you constantly. But my hope would be that like the people in your life, your friend family, the people you surround yourself with will be open and accepting of that and understanding of that and will accommodate you in that way. And if they don't, that makes me question like the quality of those friendships. And so that's kind of the thought that I came up with. But
I don't
understand
have
you're
any
not
more
the
tea to sip on, so I'm just gonna sip on my water.
but I mean, like I think it's perfectly valid to not enjoy calling yourself they. That's not obviously for everyone, and so like I definitely validate and see you for that.
People do ask constantly every day, and it's exhausting. Yeah, but
Hmm.
what do you? Because I'm imagining. I can only imagine it from the perspective of the friend of being like, I just want to call you the pronoun that you want to be called. So which one
Or
is
just
it?
call you
But
by your name. Just use your name, unless
what?
that alters
That
as
makes
well.
too much
But
sense.
but
But
like I think if that is something that's sort of stationary, then like I think that would obviously be like a perfect way to keep your friends from like misgendering you constantly.
yeah, yeah. Oh, so here's what we're gonna do because Dr. Grizzly does have to eventually go to sleep or stream or whatever they were doing after
Hmm.
this show. But you all can come by for his shows on Sundays and ask him all the rest of the questions that you
Hmm.
might still have
Feel
pending because
free.
we can be here for a while, but I would honestly rather you go into his chat and chat with him directly because he needs support. He's a lovely, wonderful human being. I don't mean that like, this
You're
guy.
right.
I didn't mean it like that. I mean like, good streamers deserve support. So I would love for you guys to support somebody who is doing a really good job on the
Thank you so
platform.
much. I really
Yeah.
appreciate that.
I will be there every day. Good. Asking all of your questions. Hi, Kisa. Thank you so much for
Blame on me.
subscribing. Thank you for the Twitch, baby. Thank you. I had my best friend's girlfriend. Blah, blah, blah. It was really funny because when I met her, I asked her for it. She said, "You'll never know." And I just
You'll
called,
never know.
Yeah. So I just called her whatever came into my head for. But some people are cool with that. Like I've talked to people who are like, "Call me he or she or they," and I was like,
perfect.
I guess I don't know if that's because I was like, okay, my brain definitely works very.
Like, which one do I pick?
Yeah, I want to pick one, but I know that's not how like we work. That's not how our minds work. That's not so I respect that, but there's definitely a crisis in my head of like, but me, and it's not about you. It's not about you. Yeah. About being questions about asexual. I did not see their message. Lost Forever, can you repost that really quickly? Because we are wrapping up, but I would, if it's important to Lost Forever, I would like to address it. Today I'm feeling mostly bored, so we know what pronoun to use. I'm always touched they can be so open about it. That every day you say thank you, right? Nighttime voice? Yeah. Well, can we please ban, they asked me if asexuals are a thing, just proving my point. Yeah, that's not gonna be, we're gonna get that out of here.
Yeah.
You made some questionable comments before about bisexuals too, so you asked some really great questions in Extrable, but like ultimately you kind of passed the zone from comfort into like literally prying and then telling people, so I think we're gonna
Can I just point that I love like this like boundary setting you're doing and like
thank you.
protecting your community.
Love we protect.
We stand.
Yeah, we protect. That's true. Bliffle. I didn't see it in chat either, but that don't mean that it doesn't happen. But Bliffle has an eagle eye, so I believe that
love
was
it.
there. Yeah. No, it's because people won't set boundaries because, and I get it because they're exhausting, but I signed up to do this, which means I signed up to do all that stuff.
Yeah, absolutely.
Yeah. Chris, do you have a few moments?
Yeah,
Different viewpoint is not a bannable offense. No. An offensive viewpoint is a bannable offense. Offensive viewpoints are also different than my viewpoints, but they are bannable offenses. Yes. So no. Invalidating people is. Yeah, that's it.
Period.
I'm sorry, I had to address that.
No, you're fine. I saw it and I was like, because we've all heard that at least once before.
No, I can't. I sorry. If one more person goes, okay, but hear me out. Like, I'm gonna make this devil's advocate argument. Yeah. But why? Why do you have to do? If you're curious, then ask it in a genuinely curious manner. Like, I don't understand.
Right.
I don't understand asexuality. Can you explain it a little bit to me? That is an open, curious question. Being like, I don't think you're a thing, but I'm just giving you a different opinion is invalidating as heck. That's not another devil's advocate.
Right.
Yeah. Okay. Anyway, please, now I would love to hear closing remarks in terms of where people can find you, how often you stream, all your other shticks, anything else that you wanted to say. Go.
All the self-promo. Well, thank you, first of all, for having me. I've so enjoyed tonight and talking with you and your wonderful community. So thank you so much for having me. And for those of you that are new to me, like you probably know by now, I go by Dr. Grizzly here on Twitch. That's DRGRZLY. I stream Tuesdays and Thursdays at 7:30 Central, as well as Sundays at 3:30 Central. I'm a variety streamer, but I do play a lot of Dead by Daylight, which may seem weird for a psychologist to be playing a game about murdering people, but
you only murder them like not for real.
That's right. Yeah, that's right. Yeah, they go right back to the fire. It's fine.
No,
it's all
but
digital.
No, there's actually real research about the fact that people who in their day jobs do really serious stuff prefer to do tend to veer into like sci-fi and fantasy kind of stuff because
that's
then
cool.
it's like an escape, and then people who are like comedians for a living really like watching like dramatic things and there's research around that.
It's very interesting.
You need to balance it out.
Yeah, absolutely. And so Sundays I stream at 3:30 Central, and Sundays is really where you can see I'll answer mental health questions from chat all the time, but Sundays is where I really sit down and open up a space for people to ask questions anonymously. And so it's of course a completely safe space. It's a predominantly queer space, and so just letting you know that. But yeah, so that's generally where you can find me three times a week.
Awesome. Awesome. We're so excited that we had to have you for a few moments. Everybody, please stick around. I am going to raid somebody, but we are going to wrap it all up for tonight. I will see you tomorrow where we're going to talk about changes and do you change or do you just grow up? We're going to answer that question and go through it. We're going to talk about some behaviorism and stuff. I love you all so much. If you feel like the world is dark and nobody can give you the love and the care that you need, go out there and be that light to others. Have a wonderful night, everybody. Stick around for the raid. Love you. Bye.
Take care. Bye.